All right, time for our daily briefing, Thursday, November 12th. And I got a couple things to cover here on the sort of increasing alert level side of things. Dr. Sanders will be referring to the facts surrounding a change to the dashboard where we're likely soon, if it's not there already, to see a COVID hospitalization. She'll give the specifics on that. And then we'll hear the governor's announcement. Your phone may have beeped earlier today with regard to the governor making some requests of folks as cases continue to escalate around the state. So we're going to do both of those. Again, briefings in the 1, 5, and 8 p.m. hours on the radio and uploaded to youtube.com/Cordova TV as soon as we can get them up there. So, Dr. Sanders, we'll begin with you. What is the update you wanted to share?
So, we just recently released a press release that the hospital has identified another positive COVID-19 patient. It is a patient that had been admitted to the hospital for end-of-life care. That end-of-life care was not COVID-related. And it was discovered during screening that they are COVID positive. Subsequent to the screening, they are also mildly symptomatic. So we feel very confident that this is a new COVID case, an incredibly isolated COVID case. We don't feel that there has been any risk to the community. We feel that the hospital's strategy and screening protocols are in place and working. We also feel that our residents and staff here are following those protocols very well and are safe.
Okay. Have you had some specific concerns from community members or other members of the team having one of our cases end up being hospitalized, or is this just sort of, what is it that made you feel that this was a particularly important case to discuss relative to some of the others?
Well, I think, first of all, it's the first for Cordova to have a case in the hospital. So our reporting, because we do report COVID cases are hospitalized, when that number goes up, it's going to get people's attention. And I want them to be aware that this one's slightly different, although that number is going to go up on the dashboard. The other thing is we see the COVID-19 cases are blowing up really everywhere across our country, across the world. And many people just saw the governor's message that he put out recently. Our hospital capacities are getting pushed and stretched, and really it's not as much the hospital capacity as it is having the staff available to treat patients. So everywhere, including Cordova, we have a limited staff that is available, and we need to be able to protect that staff and ensure that they remain healthy and still able to respond to emergencies.
Okay, and so then is the message basically the same is in terms of prevention, in terms of daily behaviors and how to conduct oneself?
Absolutely. The message is the same. I think that the governor's message was slightly more strong in terms of keep doing what we've been doing. And part of that is those practices that we had very early on in this. If you're able to work from home, if you're able to use to-go services or curbside services, please use them. Please consider celebrating holidays in a different way, not having people outside of your household coming in and gathering together. If people travel for the holidays, that really increased risk. We want people to be extra cautious and really consider not going and having that elective travel, because it certainly is going to increase their risk for not only getting COVID, but bringing it back to our community. So when people do travel and come back to our community, we want them to make sure that they follow all the precautions, self-isolate for those 5 to 7 days, and really 14 days is the safest, and do the testing that we offer for free during our community-based testing. And people can come and get those pre-tests after travel when they return.
All right. Well, thank you as always, and I assume you and I keep in touch every day, actually, but if we need to go over some more, we'll do it again tomorrow.
Absolutely. Thank you.
Now, we'll switch gears and hear the announcement from the governor that was put out here recently and reinforced with a statewide alert you might have gotten on your phone.
My fellow Alaskans, I'm speaking to you today because Alaska is facing an escalating crisis that I need your help to solve. Like the rest of the nation, Alaska's COVID-19 status is now in the red. That means COVID-19 is rapidly spreading through our communities. Our healthcare workers, first responders, and service members are being infected at unprecedented rates. A trauma nurse needs to care for accident victims. Paramedics and police officers must be able to report to work to protect Alaskans. If too many are infected, they cannot perform these critical duties. As a result of this surge in cases, I'm taking the following actions. On Monday, my new 30-day disaster declaration takes effect. I'm also directing all state employees to work from home whenever possible. Masks and distancing are mandatory at state work sites for employees and visitors alike. I must stress that the next 3 weeks are critical. Starting today, through the end of November, I'm going to ask Alaskans to sacrifice a little more by changing your daily routines. If you own a business that can operate remotely, send your employees home. I'm urging municipalities to take similar action and protect your workforce and communities. If your organization can meet remotely, please do so. If you can order food and supplies online and pick up at the curb, do so. If we are going to keep our hospitals running and businesses open, all Alaskans must return to the same mindset that worked so well this past spring. We know from experience that distance is the primary tool that works in the battle against this virus. Please stay 6 feet apart from all non-household members. If you cannot do that, if you cannot stay 6 feet apart, I'm asking everyone to wear a mask in any and every setting. We are entering the holiday season. It's perfectly understandable to want to spend time with family and friends indoors. This year, I'm asking that you consider celebrating differently. My job as governor is not to tell you how to live your life. My job is to ensure the security and safety of Alaska. I can't do that without your help. I'm asking each and every one of you to reach deep for the next 3 weeks. If we can buy time for our critical workers, if we can keep our systems operational, we can avoid being forced to take further action. But if we cannot reduce the spread of this virus, we reduce our future options for how to proceed. No matter what you believe about the virus, the facts are the facts. Hospitalizations and sick healthcare workers are reaching untenable levels. We must act together now while we still have choices. We have sacrificed so much in order to fight this virus. Alaskans have done so well, and I'm so proud to be your governor. With the advent of inoculations on the horizon, the end to this fight is in sight. For the next 3 weeks, I'm asking you, as the governor of Alaska, that we do everything possible to reduce these cases and bend this trend downward. I have great faith in the people of Alaska. We got the upper hand on this virus before, and we can do it again. I want to thank you for doubling down on your efforts to get Alaska to where it needs to be. So with that, God bless you, and God bless the great state of Alaska.
All right, that's our briefing for Thursday, November the 12th. We will continue to keep you posted, as always, in this time slot as things develop. You hear these in the 1, 5, and 8 p.m. hours on the radio, and then they're uploaded to youtube.com as soon as possible. On our channel, youtube.com/Cordova TV. Feel free, by the way, to join that channel. Robbie knows all the lingo, but you join and there's a bell that you click and then you get notified anytime something new comes out. And we, like I said, will continue to keep you posted as things evolve here at the local and the state level. Thanks for listening, and we'll rejoin regular programming.